In the complex and evolving field of pain medicine, few professionals stand out for both their clinical excellence and their dedication to community service. Dr. Rahim is one such individual. As an anesthesiologist and pain management specialist, Dr. Rahim has cultivated a reputation for innovation, empathy, and leadership in a demanding discipline. His story is one of personal resilience, cultural heritage, and professional growth. From coastal roots to clinical excellence, born in Atlanta, Georgia, in 1990 to Syrian immigrants who fled political persecution in the 1980s, Rahim was raised in Panama City, Florida. The beachside upbringing fostered a love for the outdoors. Swimming, snorkeling, and scuba diving became regular pastimes. However, it was his parents' deep emphasis on religion, family values, and a strong work ethic that would lay the foundation for his later success. Throughout high school, Rahim, D.O., showed a proclivity for leadership and service. Dual-enrolled at Gulf Coast State College, he served on the Student Government Executive Board and initiated numerous community programs, including Adopt a Highway and Habitat for Humanity projects. These early efforts signaled his lifelong commitment to giving back. Academic foundation and civic engagement. Rahim began his undergraduate studies at the University of Florida, majoring in food science and human nutrition. There, his passion for community service continued. He joined Project Downtown, a nonprofit initiative aimed at feeding the homeless, and eventually helped the organization achieve 501(c)(3) status. This early experience of integrating faith-based service with civic duty remains a core aspect of his identity. Following graduation, Rahim entered medical school in West Virginia. It was during this time that he traveled to Syria amid civil unrest to assist in a medical mission trip, an experience that profoundly shaped his future. I spent a week in an ER that had been bombed weeks prior. Each night, alarms warned of incoming airstrikes. What followed was unlike anything I had seen: doctors, nurses, and civilians doing everything they could to help those brought in by ambulances, said Dr. Rahim. I worked alongside an anesthesiologist whose ability to manage pain and save lives in such an environment deeply impacted me. That's when I knew I wanted to pursue anesthesiology. Residency and a pivotal setback. Returning to the University of Florida for residency in anesthesiology was a proud full-circle moment. However, during his second year, Rahim, D.O., herniated 2 cervical discs, ultimately requiring neck surgery. Losing function in his right arm was a deeply personal and professional challenge, but the experience reaffirmed his passion for pain management and empathy for patients. It gave me a first-hand understanding of pain and vulnerability. I'm fortunate to have had my wife and family by my side, he recalled. During his residency, Dr. Rahim participated in the Resident Education Committee, engaged in clinical research, and welcomed his first son, all while maintaining his educational and community commitments. Professional role in Texas and family life. Currently based in Texas with his wife, Jinan Erkid, Dr. Rahim practices as a clinical attending for a pain management fellowship program. Married and a father of 2, with a 3rd child on the way, he continues to balance clinical duties with family life. The values instilled in him from childhood, those of community, compassion, and service, remain integral to his professional ethos. The educational leader and innovator. As an educator, Dr. Rahim brings creativity and open-mindedness to his teaching style. He fosters an environment that emphasizes communication, contingency planning, and creativity within evidence-based practice. In anesthesia, we say there are many ways to skin a cat. It's crude, but the idea is that there are multiple safe paths to the same goal, said Dr. Rahim. By encouraging questions and open discussions, we create a space where innovation thrives. One particular case underscores this approach. During his fellowship, Rahim, D.O., specialists were confronted with a patient at the VA clinic who had undergone every conventional treatment without success. As a last resort, the team offered acupuncture. Though unconventional and lacking robust clinical data, the patient experienced profound relief. This validated the importance of holistic approaches and the need for curiosity in clinical practice. Building innovative educational infrastructure to further enhance the training experience for fellows, Dr. Rahim introduced cadaver and non-cadaveric simulation labs. These resources allow trainees to develop advanced procedural skills in a controlled environment. The confidence these labs provide is invaluable. They allow fellows to refine techniques that can ultimately change patients' lives, said Dr. Rahim. His teaching philosophy is also rooted in continual self-reflection. I regularly evaluate what worked, what didn't, and how I felt during a case. This keeps me adaptive and intellectually engaged, he shared. Incorporating technology and AI. Now based in Dallas, Texas, anesthesiologist Rahim is working on integrating artificial intelligence into the pre-operative setting. His current project involves AI-assisted risk prediction tools in pre-anesthesia testing, PAT. These tools help identify high-risk patients early, allowing providers more time for optimization and reducing adverse outcomes. It's about using technology to enhance, not replace, clinical judgment, he stated. We're building systems that maintain human touch while leveraging computational efficiency. He applies the PDSA, plan, do, study, act, model to assess new initiatives. You start with a hypothesis, test it in low-risk environments, measure the outcomes, and make data-informed decisions on whether to implement. Balancing innovation and practicality. For Dr. Rahim, the key to innovation lies in thoughtful implementation. New ideas must always pass the test of safety and logic. Where evidence is limited, collaboration, clinical reasoning, and measured experimentation are essential, said Rahim. He underscores the importance of empowering trainees. Encourage questions, respond constructively, and thank those who engage. It fosters a non-defensive learning environment where ideas flourish. Reflections in the road ahead. As Rahim, DO, looks to the future, his priorities remain constant: quality patient care, effective education, and community impact. The journey of Rahim in pain management reflects not only clinical mastery but also a deeper, values-based leadership. From feeding the homeless in Gainesville to leading AI-driven projects in Dallas, his work spans the human spectrum of care and innovation. Together with his wife, his children, and his extended family, Dr. Rahim stands as a compelling example of how professional excellence can be fused with cultural heritage, service, and empathy. In every patient he treats and every student he mentors, his legacy continues.